Gene therapy for lung cancer. What are living drugs? Imagine turning your own immune system into a powerful weapon against lung cancer. That's the idea behind what are called living drugs. These are a new type of gene therapy that uses living cells, usually immune cells like T cells, which are specially modified to fight cancer more effectively. In lung cancer, scientists are working on ways to reprogram a patient's immune cells so they can recognize and attack cancer cells directly. This process involves taking T cells from the patient, modifying them in the lab to include special receptors that target proteins on lung cancer cells, and then infusing these engineered cells back into the patient. Once inside the body, these cells can seek out and destroy cancer cells more precisely than traditional treatments. The most common example of these living drugs is called CAR T-cell therapy, which stands for chimeric antigen receptor T-cell therapy. In this process, T cells are extracted from the patient, genetically engineered to produce receptors that recognize specific proteins on cancer cells, and then expanded in the lab. When reintroduced into the patient, these modified T cells can hunt down and kill cancer cells that display the target protein. For lung cancer, especially small cell lung cancer, researchers are exploring CAR T-cell therapies that target antigens like DLL3, which are found on lung cancer cells. Some advanced versions, known as armored CAR T-cells, are designed to produce immune-stimulating proteins such as interleukin-12. These help the T cells overcome the tumor's defenses and improve their ability to attack solid tumors. Gene therapy in lung cancer isn't limited to living drugs. It also includes strategies like boosting the immune system to better fight cancer, delivering genes that cause cancer cells to self-destruct, blocking genes that promote tumor growth, or replacing tumor suppressor genes that can trigger cancer cell death or prevent new blood vessels from feeding tumors. While these approaches are promising and some are being tested in clinical trials, gene therapy for lung cancer is still largely experimental. It is usually used alongside established treatments like surgery, chemotherapy, targeted drugs, and immunotherapy. It's important to remember that while CAR T-cell therapies have become more common in blood cancers like leukemia and lymphoma, their use in lung cancer is still under active research. The complex environment of solid tumors and the diversity of antigens make developing these therapies more challenging. Patients interested in these cutting-edge treatments should speak with their oncology specialists to understand what options are available, including clinical trials. Living drugs representing an exciting frontier in lung cancer treatment, harnessing the power of genetic engineering to help the immune system fight cancer more effectively. As research advances, these therapies could become an important part of personalized cancer care, but they are still in the early stages compared to more established treatments. Always consult healthcare professionals to explore the most appropriate options based on individual health needs.